Time now for Morning Rounds, our look at the medical news of the week. And we begin with a surprising and concerning rise in colon cancer death rates among younger Americans. A new research letter published by the American Medical Association examined mortality rates for those aged 20 to 54.
The major finding from 2004 to 2014, the colon cancer death rate for white Americans increased by around 14%, or roughly a 1.4% annual increase. Statistics on African Americans actually showed a decline. Here to discuss the research is CBS News contributor Dr. Narula. Tara, are there signs, symptoms that people should keep in mind here?
This is very important for people to understand. This is a very common cancer. It's the third leading cause of cancer death in women, the second leading cause of cancer death in men, estimated that it will take about 50,000 lives this year. So while many times it can remain asymptomatic, there are things that you can look for. For example, if you notice any bright red blood in your stool, or change in the stool where it's a little bit darker. You have change in your bowel habits, so either diarrhea or constipation, belly pain, unusual fatigue, weakness, or loss of appetite. And then anemia. Sometimes that's the only sign, a low blood count or anemia, that will pick up that something is wrong. Now, there are certain conditions that can predispose you genetically, if you have a strong family history, if you have other hereditary conditions or genetic conditions, and then inflammatory bowel disease like Crohn's or ulcerative colitis. But most important to remember is that there are lifestyle risk factors, things that you can do yourself that can prevent or help to reduce your risk. So, for example, diabetes, heavy alcohol use, smoking, people who eat a diet that's high in red or processed meat, who don't exercise as much, who are overweight or obese. All of those things will increase your risk of developing colon cancer.
As Dana mentioned, the rate actually declined among African Americans. So do we know why this affects some groups more than others?
We don't really, but certainly there are or seem to be differences racially and ethnically. One of the theories that has come about is this idea that the microbiome may have an effect. So the microbiome, what is it? It's the trillions of bacteria that live in our gut, over 1,000 species, and that somehow through our changes in diet, antibiotics, exposures, we're altering our microbiome, and that this may be affecting us in differential ways, so that certain ethnicities or races have different microbiomes, and certain bacteria may actually promote the development of cancer. But important to understand from this study, we talked about African Americans. In general, they are actually at highest risk of developing colon cancer, highest risk of dying from colon cancer. They develop cancer a little bit differently, tends to be more right-sided. It can be at younger ages, more aggressive. So actually, the American College of Gastroenterology recommends that African Americans consider being screened as early as 45.
Wow.
Our next topic deals with another serious health issue, stroke. According to the Centers for Disease Control, someone in the United States suffers a stroke every 40 seconds.
A new study found that while stroke rates are going down for men, that might not be the case for women. CBS News chief medical correspondent Dr. John LaPook took a closer look.
In 2013, Diana Hardiman was 30 years old, a vegetarian, a non-smoker, a surfer, and the picture of health, until she had a stroke.
The paralysis ended up seeping down from my arm to my leg, leaving the whole right side of my body basically immobile. I thought maybe I'm becoming paralyzed or potentially seeing death.
That had to be just terrifying for you.
It was terrifying.
Hardiman is an example of a puzzling and concerning trend. This week's report found from 1999 to 2005, the incidence of stroke declined in both men and women. But from 2005 to 2010, while the rates among men continued to drop, they stayed the same for women. Dr. Catherine Rexroad of Brigham and Women's Hospital says risk factors for stroke, such as obesity, high blood pressure, an irregular heartbeat, and diabetes, may for some reason affect women differently than men.
Diabetes is a strong risk factor for stroke in both men and women, but in women, the risk is 26% higher than in men with diabetes.
So you want the blueberry, right? Yeah.
Hardiman recovered and went back to her gourmet ice cream business in Brooklyn. But last June, she had a second stroke.
I had to stop being CEO of my ice cream business and start being CEO of my health and put that as my priority, which I did.
This time, doctors found the cause, a small hole in her heart, and repaired it.
When I was told that I had a stroke, I've always associated it with the elderly, something that your grandmother has, but never thought it would be something that would happen to me.
I think a lot of people would feel that way. It's surprising to read that according to the CDC, stroke kills twice as many women as breast cancer. Is that correct?
This is something that needs to be on every woman's radar, and I don't think it is. As a cardiologist, we talk about it a lot, and women are really unaware that this is the third leading cause of death for women. 1 out of 5 women will have a stroke in their lifetime, and more women than men are affected by stroke. And as you saw, it is debilitating when you suddenly cannot see, cannot walk, cannot move part of your body, can't speak. This is life-altering. And so we're just starting to really understand more about this. In 2014 is when the first guidelines were really published about women and stroke. And we learned that there are risk factors that kind of tend to affect women more than men, that are more prevalent in women. For example, hypertension, a big risk factor for stroke. In addition, things like migraine with aura, depression and anxiety and stress, more prevalent in women. Then there are sex-specific risk factors like pregnancy, gestational diabetes, preeclampsia, oral contraceptive use, as well as hormone replacement therapy. Again, all of these raising the risk of stroke. So really important for women to not only recognize the risk, but realize that 80% of strokes are preventable by looking at their lifestyle. And so improving things like exercise, diet, not smoking, monitoring blood pressure, checking their cholesterol, monitoring blood sugar. So there's a lot we can do as women to prevent this.
Totally unaware of that. I mean, I always associated it more with men than women. I'm stunned by those numbers. All right, finally, the ongoing battle against antibiotic-resistant bacteria. Research published by the National Academy of Sciences showed the development of a test that helps doctors better treat your infection, and the test only takes around a half hour to produce a result.
So this is really great, right? So you go to the doctor, you have a urine infection, for example, and the doctor says, well, I'm not sure if this antibiotic is really going to work for you, but I'm going to give it to you anyway. And so usually the test to see if your particular bacteria is resistant or sensitive takes about 1 to 2 days. This would shorten that time to about 10 to 30 minutes. So while you're in the office, they can test your urine, for example.
They can do it right there, right away.
And then tell you, here's the perfect antibiotic that is perfect for the bacteria you have. And it avoids, in the bigger picture, the creation of antibiotic resistance, which is what happens when you give what we call big gun antibiotics that kill tons of bacteria.
That you don't really need for the infection.
Exactly.
Dr. Narula, thank you.
Thank you.